open appendectomy, or removal of the appendix by a large surgical incision. What is this procedure, and how is it performed? The appendix is a closed-ended, narrow tube off your cecum, or the beginning of your large intestine, that is just a few inches long. Appendicitis is an inflammation of your appendix. It is thought that the appendix opening gets clogged, leading to inflammation and infection of it. Typically, when this occurs, the appendix must be removed. An open appendectomy is performed through a skin incision 2 to 3 inches long that is made in the right lower abdomen while you are under general anesthesia. You will be unconscious and pain-free. The appendix is then detached from the cecum. Any abscess is drained, and the skin is usually closed. Why is this procedure performed? The surgery is done to remove the inflamed appendix. As the inflammation leads to infection, this may progress to perforation of the appendix, and the infection can spread throughout the abdominal cavity, potentially making patients very ill. What to expect after the surgery? After surgery, you should expect to be sore where the incision was made. You will be given pain medication to feel more comfortable. You may be nauseated and vomiting from the anesthesia or medications. Generally, a diet is resumed the next day, and you are discharged from the hospital in 1 to 2 days if it was a simple appendectomy. If the appendix was perforated, you may have to stay longer, 4 to 7 days, for intravenous antibiotics. If the appendicitis was uncomplicated, dressings will be removed in 1 to 2 days, and then you may shower. If the appendix was perforated, your skin incision may be open, and you will be taught wound care. For a simple appendectomy, you should be able to resume normal activities in 2 to 3 weeks, with no strenuous activity for 6 weeks, such as heavy lifting greater than 15 pounds. That should be avoided for 6 weeks as well. Avoid driving and drinking alcoholic beverages while on pain medications. What are the risks and complications of this procedure? Just as there may be benefits to the procedure proposed, medical and surgical procedures also involve risks. These risks include allergic reaction, bleeding, blood clots, infections, adverse side effects of drugs, blindness, and even loss of bodily function or life, as well as the risks of transfusion reactions and the transmission of infectious disease, including hepatitis, acquired immune deficiency syndrome, from the administration of blood or blood components. There are also particular risks associated with this procedure. These risks include, but are not limited to, risks of general anesthesia, such as difficulties with breathing and reactions to the anesthetic, gases, or the medications used. Wound infection, the most common complication. You should look for redness and warmth at the incision site and alert your physician should these symptoms occur. Abscess formation, less common and may require drain placement. This is typically seen with complicated or perforated appendicitis. Injury to the small or large bowel. The bowel can be injured as the appendix is removed. Post-operatively, you might have fever and pain. Alert your physician. Obstruction from scar tissue or adhesions. As you recover, your body forms scarring or adhesions inside, just like scarring on injured skin. Sometimes this scarring can lead to an obstruction of your intestines. Ileus, or a slow return of bowel function. When any abdominal procedure is performed, manipulation of the intestines can lead to a delay in normal bowel function. You may not be hungry or may become nauseated if you eat too soon. A key predictor of the return of bowel function is the passing of gas. You should be aware that living without your appendix has no known health problems. Before you agree to any operative procedure, it is important to remember that each patient is different and that the outcome of any surgical procedure can never be guaranteed. You should understand that there may be complications that have not been mentioned and that it is not possible to anticipate all complications or to answer each and every question. Again, you should be aware that in the practice of medicine, unforeseen and unexpected risks or complications not previously discussed may occur. You should also understand that during the course of proposed procedures, unforeseen conditions may be revealed requiring the performance of additional procedures, and such procedures may need to be performed. Keep in mind that there is no substitute for an open and honest discussion with your own surgeon or physician regarding this procedure. You should also be given any available treatment alternatives to this procedure by your doctor. Be sure to discuss any questions or concerns with your doctor.